Hi, and thanks for joining me for another Elder Watch web series. This time we'll be talking about long-term care planning, and we're going to start with some of the options that you can consider when making this journey for yourself or for a loved one, as well as some of the common acronyms and some of the jargon that might show up while you're on this journey. Let's get started. This series is brought to you by ElderWatch, a 20-plus year collaboration between AARP and the Colorado Attorney General's Office. We fight the financial exploitation of older Coloradans through education and outreach, data collection, and assistance on our volunteer-staffed fraud victim support helpline. If you or someone you know may be the victim of fraud or a scam, or maybe someone or something you found online sounds just a little bit too good to be true, go ahead and give us a call. Our phone number is 800-222-4444. Select option 2. In this series brought to you by ElderWatch, we'll be covering 4 topics under the umbrella of long-term care planning. First, we'll talk about some of the options available to you when it comes to long-term care. And we'll also talk about some of the acronyms and jargon that you might experience while you're on this journey. After that, we'll talk about considerations that you might want to keep in mind as you're visiting different facilities or as you're comparing one versus another. After that, we'll talk about insurance and how it comes into play when it comes to long-term care planning. And then lastly, we'll talk about strategies to afford things that insurance won't cover. So this series was actually inspired by one of our fabulous volunteers who asked me, what should you do to plan for long-term caring? Should you plan in advance? Should you pick a location in advance? Do you need extra savings? They had a lot of questions and I didn't have a lot of answers, so I decided to make this presentation. But personally, I began getting very invested in this topic, particularly planning for it in advance. And part of this was because I learned that 60 to 75% of us will need some type of long-term care in our futures, in our lives. One reason that it's really important to start thinking about these things in advance is rising cost. In Colorado, where ElderWatch is located, the average cost of long-term care has jumped by 124% since 1990, and it's expected to continue to rise by approximately 6.2% per year. Unfortunately, in Colorado, as well as many other places, we're also experiencing a problem of supply and demand that was not at all aided by the pandemic. Care facilities that closed during the pandemic, and according to one source, this was as many as 579 nursing homes alone, they didn't open at the same rate, or I should say reopen at the same rate, meaning that people end up staying in hospitals longer because they're waiting for this type of long-term care and it's just not available because more people want it than we have beds available. So if you start planning in advance, can also make that a little bit easier for you as well. And then thirdly, adding insult to injury is staff shortages. According to some, we've experienced a 15% drop in capacity, which makes this already pretty complicated situation even more complicated. This triple threat, if you will, of increasing cost, more demand than supply, and staff shortages, on top of navigating what is already a very complicated, difficult, and emotional system, really highlights why I've become passionate about understanding and planning in advance for long-term care planning. And so I'm hoping that just an ounce of preparation will really help us wherever you are in this journey. The more you can learn, the more you can think about, the more you can plan in advance, the better off you'll be. So thanks for taking some time to sit here and learn about some options and acronyms with me. All right, here's my last page of exposition. So before we get things started, 2 acronyms that I do want to bring to your attention are ADLs and IADLs. ADLs, or activities of daily living, are essentially the activities that we must do to continue to survive as well as exist in society. So ADLs are things like being able to bathe ourselves, being able to feed ourselves, using the restroom independently, and getting dressed. IADLs, on the other hand, are instrumental activities of daily living, and I think of these as the vehicle to accomplish our ADLs. So, for example, an instrumental act of daily living would be going to the grocery store. And so you don't need to go to the grocery store to survive, but you need food to survive. So being able to transport yourself isn't necessarily the thing that's keeping you alive, but it is the means to get what we need to keep us alive. Similarly, doing chores might not be essential to your survival, but maintaining good hygiene is. So that's how IADLs and ADLs differ. Now, in terms of how I've organized this presentation, I went back and forth and back and forth and back and forth on how to organize all of these different options, because as you'll learn, there's a lot of them. In fact, there's so many that I had to break down the options and acronyms presentation into 2 presentations. So ultimately, I decided to organize them by length of stay as well as level of assistance. Now, when I say short term, I'm talking about options that are designed for a few days to a few months. And when I say long term, I'll be talking about options that are designed for a few months of stay to potentially the duration of someone's life. When it comes to assistance level, I'll be grouping things on a spectrum from low to high level of assistance. When I say low level of assistance, it's for somebody who can or will be able to meet the majority of their ADLs, and they don't need complex medical care. So they might need meds management, but they don't need to be intubated. Also, when I say when I say a lower level of assistance, I'm talking about care for someone who doesn't need constant monitoring for their safety. In this low category, generally the goal is to get you back to your normal level of function or get you well enough to go home so that you can heal there. On the other side, in the high level of assistance, this is generally treatment for something that is chronic or that isn't expected to go away or improve. This category is also for individuals that might need help meeting many, if not all, of their ADLs, and also for those who have complex medical care and need to be constantly monitored for safety. Woo! All right, we're done. We're ready to roll into the meat of the presentation. All right, so as I mentioned before, I'm going to be grouping things on spectrums of level of assistance as well as duration of stay. So for today, we are going to be looking at options that have lower levels of assistance that are both short-term and long-term care options. So first, let's get into options when you or your loved one needs a lower level of assistance for what you expect to be a shorter period of time. So again, in that category, I'm talking about a couple days to a couple weeks. Generally, in this category, the goal is to get you well enough to come home and or to return to your usual level of function. Short-term, lower level of assistance might be something that you need if you're healing from surgery or a medical intervention, you're healing from a fall, or healing from an illness, with the caveat that it's believed that all of those things will go away and or improve. So we might be talking about a broken bone or the flu. And there may also be other reasons not listed here that lead you to seek short-term assistance in that category of lower level of assistance. None of the lists I'll give you in this presentation are intended to be comprehensive, but they are intended to kind of give you an overview of what options are out there. Again, this list isn't supposed to be exhaustive, but 3 types of facilities that you might find in the short-term, lower level of assistance options for you or your loved one are long-term acute care, a skilled nursing facility, or home health care. With a name like long-term acute care, which I'll call LTAC from now on, you might be surprised that I've listed it as a short-term option, but the average length of stay in an LTAC is about 25 to 30 days. An LTAC is generally an option used after discharging from the hospital while you're in a recovery period, but usually with the intention that you're going to get back to your normal level of functioning and or that you're going to be able to go home and continue to live as you were. I'm listing this in the lower level of assistance because, like I said, it's a step down from the hospital. And so though care might still be rigorous, it's usually shorter term and will likely taper off as you return to a higher level of function. This might be for someone who, for example, needs complex wound care, but they can still generally perform ADLs on their own, or they'll be able to soon. A skilled nursing facility, also known as a SNF, is another short-term option for someone who is ready and able to participate in rehabilitation activities like occupational and physical therapy. The goal here, similar to an LTAC, is to get the patient well enough to get home, and the average length of stay here is a little bit longer. It's usually between 3 and 6 weeks. This is another in-between option between the hospital and discharging back to your house or maybe an assisted or independent living facility. Generally, patients in this option are a little bit less medically complex than those who are in an LTAC. And then home health is the final option that I'm listing here. There are similar home health programs for more complex or chronic medical concerns, but in this context, it's also an in-between between the hospital and being back to yourself. So this might be for someone who is discharging from the hospital, but they still need more support than they can do at home by themselves. It's important to note that this is not really ever a 24 hours a day type of care, and the nurse or home health aide may only come 1 to 2 days a week for 45 minutes to an hour, depending on the situation. For this option, someone must be homebound or unable to leave the house without assistance, and depending on how it's paid for, it might be capped at 21 days. Home health does not include supervision and does not tend to include other supports like cleaning, laundry, or dishes, even if these are difficult for you or your loved one to do because of the medical condition. Adult members using home health services also have a daily cap of the services that can be provided within the home. All right, so in quick summary of our short-term, lower level of assistance options, SNFs and LTACs tend to provide that highest level of care in the lower level of assistance, as I've broken it up for this. And individuals in LTACs and SNFs generally are there for about 20 to 30 days while they are healing from an illness or an injury that is expected to improve. Home health services provide the lowest level of assistance in this short-term, lower level of assistance. And it doesn't mean that somebody is present 24 hours a day, 7 days a week, or that someone is on call. And service visits might not be as long as you imagine, but it is definitely another option in this little grouping of short-term, lower level of assistance, long-term care for something that probably you'll get better from. Next, let's dig into options for a lower level of assistance over a longer period of time. So again, for this one, we're thinking a couple of months to maybe the rest of you or your loved one's life. Now, in this lower level of care, longer term placement, we're kind of looking at them for reasons different than those shorter term placements. These options might be for someone who is feeling isolated and wants to be back in community, for someone who is downsizing or feels like they have too much house, for someone who will or later will want some support on their ADLs, but for the most part, they're able to manage by themselves, or maybe for someone who, in addition to there being too much house, the housework is also becoming a little bit much. You need a little bit more support with things like lifting, you'd like some housekeeping type of thing, things like that. So in this section, we'll also talk about 3 options. The first of which is independent living, and it's exactly what it sounds like. This is for someone who can independently meet all of their ADLs. So again, feeding yourself, using the restroom, but maybe you can't meet all of your IADLs, like driving, quite as easily anymore. This is also for someone who wants a more social environment with activities and possibly meals provided. And often this type of long-term option is apartment-style living units. A CCRC, or a continuing care retirement community, can really fit into different quadrants within my little matrix, depending on who is going and why. But this type of community aims to provide a continuum of care as an individual ages and gradually needs more support. So this is a long-term option for someone who wants to stay in the same place through different phases of aging. So for example, you might move in to a CCRC while you are still able to meet, your ADLs. So you're in the independent living section. But then as time goes on, maybe you start experiencing dementia and Alzheimer's, and then you need memory care. So within the CCRC, there might be a memory care unit. So you can just transition, maybe a block over or a building over, and you're still within that familiar environment. So they're kind of providing many options for different phases of aging. And that's the benefit of a CCRC. They provide a wide range of care, services, and activities all in one place, which offers a little bit more sense of stability and familiarity as we age and as our health conditions change. Now, you may also be surprised that I've listed adult daycare, and I don't love that term, but we'll call it that for now. So you might be surprised that I listed adult daycare as well as senior centers here. But the reason I did so is because they can be a cost-effective solution to have the best of both worlds, especially when caregivers and the sandwich generation, or the generation that is supporting their own children as well as their parents, they're sandwiched in the middle. So this can be a great option for caregivers in that sandwich generation. And these centers are designed to provide care and companionship for older adults who need assistance or supervision during the day. I also list this resource as a consideration because combined with caregiving or in-home care, it might be less expensive in the long run to use an adult day center, but it is the lowest option of care that we have listed here. The goals of these programs are to delay or prevent going into a facility by providing alternative care to enhance self-esteem and to encourage socialization. Now, generally, there's two types of adult day programs. There's adult social day and adult day health care. Adult social day provides what you would think: social activities, meals, recreation, and some maybe health-related services, whereas adult day healthcare offers more intensive health, therapeutic, and social services for individuals with serious medical conditions at risk of requiring nursing home care. Now, not all adult day programs provide all of the same services. Some might provide things, for example, like medication management. So it's important to check what is and is not provided and to make sure you understand your needs before really encountering any of these options, but especially with this one. In summary, independent living and adult day centers generally provide a lower level of assistance compared to a CCRC, although, as I mentioned before, certain adult day centers might provide more support than others. A CCRC, or continuing care retirement community, is designed to provide support as an individual ages and changes. So like I said before, you might move in for independent living, which would be a lower level of assistance. And then as time goes on, you might need a higher level of assistance. And a CCRC is designed to be a one-stop shop. It's an area that has all of these different levels that you might need over time. And it's listed as the longest term care because it's designed, like I said, to be a one-stop shop. It's supposed to be able to serve you over the course of your lifetime. All right, we did it. First chapter is done. Today we covered 6 lower level of care options, 3 that are shorter term, 3 that are longer term. Next time, we'll conquer the bottom half of that quadrant, and we'll look into higher level of care options for both short-term and long-term. My name is Jessica Zawadsky. Thanks for joining me, and I'll see you next time as we continue our long care planning web series brought to you by ElderWatch Colorado. See you later.